All right, let's jump right in, shall we? Today, we're taking a deep dive into the world of AI in healthcare.
Sounds good.
Specifically, how it's being used to analyze medical images,
Hmm?
like, CT scans and things like that. You probably heard how AI can speed things up, but what about accuracy?
Yeah, that's the big question, right?
Right.
AI can be incredibly helpful, but it's not perfect. Mistakes can happen.
Yeah.
And in medical imaging, well, those mistakes could have serious consequences.
That makes sense. So who's catching those errors? I'm guessing it's not as simple as just hitting undo.
You're right, it's definitely not that simple. Right now, it often falls to busy radiologists to review and correct any errors made by AI systems, and
Yeah.
that can create a real bottleneck.
I bet. Especially when you consider just how many medical images are being generated these days.
You're absolutely right. Publicly available data sets of abdominal CT scans, for example, they've just exploded in size.
Really?
Yeah, we've gone from having a few hundred scans with detailed annotations in 2020 to over 10,000 now in data sets like Abdominatlas and FLAIR.
That's a massive increase.
It is.
So even if AI is helping to create those initial annotations, it still sounds like a pretty overwhelming task for radiologists to double-check everything.
It is. It's a massive amount of data, and ensuring its accuracy is, well, it's essential. And this is where a really fascinating development comes in.
Okay.
Researchers at Johns Hopkins University have created something called Label Critic.
Label Critic.
It's essentially an AI system designed to check the work of other AI systems.
Okay, so instead of radiologists manually reviewing every single label, we have AI stepping in to help with quality control.
Exactly.
That sounds pretty promising.
It is. It really is. The researchers behind Label Critic, they recognize that critiquing is easier than creating, meaning that AI systems might already have the capabilities to evaluate the accuracy of medical image annotations.
So they didn't have to start from scratch and train a brand new AI specifically for this task.
Precisely. They cleverly tapped into the power of pre-existing large vision language models.
Or LVLMs. These models have been trained on massive data sets of images and text, making them adept at understanding both.
That makes a lot of sense. So Label Critic acts as a sort of intermediary. It takes the medical image and the AI-generated label and then presents it to an LVLM for evaluation.
Yes, and it does so in a couple of really clever ways. First, it can directly assess a single AI-generated label to see if there are any obvious errors. For example, if an AI misidentified the aorta, Label Critic could potentially flag that mistake.
Oh, I see. Because the aorta has such a distinctive shape, even I know it has a curved arch at the top.
Right.
So Label Critic could pick up on that kind of anatomical inconsistency.
Exactly.
Okay.
But it gets even more impressive.
Okay.
Label Critic can also compare multiple AI-generated labels for the same image.
Oh, wow.
So let's say you have 3 different AI systems, each providing its own interpretation of a CT scan. Label Critic can analyze those interpretations and determine which one is the most accurate. That's remarkable. So it's not just about catching errors, it's also about selecting the most reliable interpretation from a set of options. It sounds like Label Critic could really streamline the process of reviewing AI-generated annotations. But I'm curious, how does it actually analyze 3D CT scans? I thought LVLMs were mainly designed to work with 2D images.
That's a great question, and this is where the ingenuity of the researchers really shines through. Label Critic uses 2D projections of the 3D CT scans.
Okay.
You can think of them as kind of flattened representations of the scan, almost like creating an X-ray image.
So they're essentially converting the complex 3D data into a format that LVLMs are already familiar with.
That's right. And this method offers several advantages.
Okay.
First, it's much faster and more efficient for the LVLM to analyze a single 2D projection than to process all the individual 2D slices that make up a 3D CT scan.
Right.
Second, these projections resemble X-ray images, which LVLMs have already seen tons of during their training, giving them a solid foundation for analysis.
That's really clever. It's like they're speaking the LVLM's language, so to speak. But even with this clever projection technique, how do the LVLMs actually know what to look for in a medical image? It's not as if they went to medical school.
Right, that's where prompt engineering comes in.
Okay.
It's the art of crafting specific instructions or prompts to guide the LVLM's analysis. The researchers carefully designed these prompts to incorporate anatomical knowledge.
So it's like giving the LVLM a set of guidelines to follow.
Exactly, like a checklist of what to look for. For example, a prompt might say something like, The aorta should appear as a long vertical red line with a curve at the top.
I see.
This provides the LVLM with some context and helps it focus its analysis on the relevant anatomical features.
That makes sense. They're giving the LVLM just enough information to make an informed decision about the accuracy of the label. What I find really fascinating is that they also use a technique called dual confirmation. Can you explain how that works?
Sure, in essence, they're asking the LVLM the same question twice, but they present the images in a different order each time. This helps to check for consistency in the model's responses and ensures that its analysis isn't influenced by the order in which the images are presented.
That's a brilliant approach. It's like double-checking the LVLM's work to make sure it's giving reliable and consistent answers.
Yeah.
But let's move from theory to practice. Did the researchers actually test Label Critic on real medical image datasets?
They did, and the results are really compelling.
Okay.
They tested it on 2 datasets.
Okay.
The first one, called AtlasBench, is a publicly available dataset that compares different versions of AI-generated labels for abdominal CT scans.
A public dataset, you say?
Yeah.
That means other researchers, or even just curious folks like me, could take a look at the data and see how Label Critic performed.
Exactly. Transparency is key in research like this. The second dataset they use, called JHHBench, is a private dataset from Johns Hopkins Hospital. It's unique because it compares AI-generated labels to expert human annotations, giving us a direct comparison between AI and human performance.
So this is where we see how Label Critic measures up against the gold standard of human expertise.
Exactly.
So this is where we see how Label Critic measures up against the gold standard of human expertise.
Exactly.
What did they find?
Their results were incredible. When comparing AI-generated labels to those made by human experts, Label Critic achieved 97.5% accuracy in choosing the best label.
Wow, 97.5%. That's amazing.
It is.
That's a really impressive level of accuracy. This kind of performance could potentially lead to faster and more accurate diagnoses, maybe even saving lives by catching those subtle errors that human eyes might miss.
Absolutely. And it really highlights a key aspect of Label Critic. It's not just about speed and efficiency, it's about improving the quality and reliability of medical image analysis as a whole. And these tests revealed some truly fascinating results about Label Critic's capabilities.
Like what?
Well, one of the most striking findings was Label Critic's ability to generalize. It could adapt to new types of scans and anatomical structures with minimal or even no additional training data.
So it's not limited to just abdominal CT scans. It has the potential to be applied to different parts of the body and even different types of medical imaging.
That's right. This adaptability makes it a very versatile tool with broad applications in the medical field. And as we've already discussed, it achieves remarkably high accuracy in both detecting errors and comparing labels, significantly reducing the manual effort required from radiologists.
And that's a win for everyone involved. It frees up radiologists to focus on the more complex cases that require their expertise, ultimately leading to faster diagnoses and treatment decisions for patients.
Exactly. But what's even more fascinating is what this technology could mean for the future of healthcare. Think about the impact on medical training, for example. Imagine medical students using AI-powered tools like Label Critic to learn anatomy and practice image interpretation.
So instead of just reading textbooks and looking at static images, they could have an interactive learning experience with immediate feedback on their analysis.
Precisely. It would be like having a virtual expert available around the clock, guiding their learning and helping them develop their skills much faster.
And this wouldn't just be limited to students, right? Even experienced radiologists could write.
But what if we could use AI to tailor the analysis to each individual patient?
So instead of just looking for anything unusual, the AI could be trained to look for specific things that are relevant to that particular patient's medical history, genetics, and lifestyle.
Exactly. Imagine an AI system that could take into account a patient's age, family history of certain diseases, previous diagnoses, even their lifestyle choices like smoking or diet. It could then highlight areas of concern that might be missed with a more general analysis.
That's an incredibly powerful concept. It's like moving from a standardized test to a fully customized assessment.
That's a great analogy. And the beauty of this approach is that it could potentially be applied across a wide range of medical imaging modalities, from X-rays and CT scans to MRIs and ultrasound.
Okay, I'm getting really excited about all the possibilities here, but I also want to make sure we're being realistic. Are there any challenges or potential downsides we need to consider as this technology continues to evolve?
Of course. As with any powerful technology, there are always challenges to address. One of the biggest is ensuring that these AI systems are integrated into healthcare in a way that enhances rather than replaces human expertise.
So it's about finding the right balance,
Right.
making sure that AI is a tool that empowers doctors and radiologists to make better decisions, not a replacement for their skills and judgment.
Exactly. We need to ensure that the human element remains central to healthcare, even as AI becomes more sophisticated and capable. Another challenge is the need for continuous validation and regulation. As AI tools like Label Critic become more complex, it's crucial to have robust systems in place to monitor their performance and ensure their accuracy and reliability.
So it's not a set it and forget it kind of thing. We need to be constantly evaluating and refining these systems to make sure they're working as intended and adapting to new challenges and discoveries.
Absolutely. And this will require collaboration between researchers, clinicians, regulators, and even patients. It's a complex ecosystem, but one that has the potential to revolutionize healthcare if we navigate it thoughtfully and responsibly.
What I find particularly inspiring about this research is the way the team behind Label Critic chose to leverage existing AI models instead of building something entirely new from scratch. It's a fantastic example of how we can take advantage of the incredible progress that's already been made in AI to create solutions for real-world problems.
That's what's so fascinating here. They saw an opportunity to combine existing technologies in a novel way to address a real need in the medical field. Sometimes the most innovative solutions arise not from reinventing the wheel, but from finding new and creative ways to use the wheels we already have.
It's like that old saying, necessity is the mother of invention. And in this case, the need for more efficient and accurate medical image analysis has led to a truly ingenious solution. It makes you wonder what other creative uses of AI are just waiting to be discovered. Could similar techniques be used to improve accuracy and efficiency in other fields, like self-driving cars or financial modeling?
That's a great point. The potential applications of AI are vast, and we're really just beginning to explore the possibilities. This is a field that's moving at an incredible pace, and it's truly exciting to think about what the future holds.
Yeah, it's definitely given me a lot to think about. The idea of AI not just assisting with medical image analysis, but actually helping to ensure its accuracy, it's pretty incredible.
It really is a paradigm shift, and it highlights the incredible potential of AI to not only accelerate scientific discovery, but also to make those discoveries more reliable and impactful.
Makes you wonder what other breakthroughs are just around the corner. What other creative applications of AI are waiting to be explored?
The possibilities seem, well, pretty much endless. If we can use AI to improve the accuracy of medical image analysis, imagine what we could achieve in other fields that rely on complex data interpretation, like climate modeling or drug discovery.
It's really exciting to think about the potential, and I appreciate you walking me through all of this. I feel like I've gained a whole new perspective on AI and healthcare, and it's definitely sparked my curiosity to learn even more.
Well, I'm glad to hear that. It's a field that's constantly evolving, and there's always something new to discover.
Well, on that note, I think we've reached the end of our deep dive for today. We've covered a lot of ground, from the challenges of medical image analysis to the ingenious ways AI is being used to address those challenges, and even glimpsed the potential for even more transformative applications in the future.
It has been a fascinating conversation, and I hope it's encouraged our listeners to think about the role of AI in their own lives and the exciting possibilities that lie ahead.
Absolutely. It's a reminder that AI isn't just some abstract concept or futuristic fantasy. It's a technology that's already having a profound impact on the world around us, especially in fields like healthcare. And as we continue to explore its potential, I think we'll see even more incredible breakthroughs and innovations in the years to come.
I completely agree. It's an exciting time to be following the developments in AI, and I can't wait to see what the future holds.
Well, until then, keep those brains buzzing, and we'll see you on our next deep dive. Thanks for listening.